Many schools don't have the opportunity to hold a fourth-year clinical dentistry rotation specifically around dentistry and oral health care.
We see our clinical students graduate and go out and do a ton of dentistry in practice, and our challenge as clinical instructors is to find the caseload and the opportunity for them to get hands-on learning, and this dental academy was a great opportunity for us to do that.
We've been so excited to have the opportunity to run the first pilot for a fourth-year clinical rotation for dentistry with the Auburn Veterinary School.
We started off on the Midmark campus helping them understand the why of what they're doing and why veterinary dentistry and oral health care is so important. Through a plant tour, they got to see how our equipment is made and why it's made the way that it is and the quality behind it. We brought them into the experience center so that they could see the thought that we put into our design and how that impacts their safety, their productivity, and the efficiency of their day. And then at the second part of the week, we took them off campus so that they could learn those clinical skills. We taught them about the equipment, how to maintain that equipment. We taught them how to take full mouth dental radiographs, how to interpret those radiographs. And then Dr. Paul Mitchell spent 2 days with them on canine species and feline species, learning how to do flaps and oral surgery techniques, building up their confidence.
It's very important to have the actual clinical instruction, but I liked that we talked a lot about client communication and kind of meeting people where they are, because I know that at least our perception in the field is cost is always the barrier, and we don't really know what people are going through and we don't know what they can afford, so making sure that we discuss that with them and do the best that we can within their means, and we can still make a difference.
We have just had the best couple of days learning exactly how to do oral surgery and the right ways to approach oral surgery. Being able to take out the teeth, that was a lot harder than what I was expecting. Figuring out the right ways to hold the instruments and the right ways to avoid the gum line and to avoid catching the lip and to actually get down to bone and be able to expose that tooth is so rewarding once you're finally able to get it out and to extract it. Our first tooth that we extracted, I think it took us about 3 hours. On our last day, I did that in about 25 minutes. Now I know the exact approach.
So getting hands-on experience the last couple days, it really builds your confidence. Now when complications come up, we've gotten to work through them in a non-life-threatening scenario, and so that's a real confidence builder going into practice as a new grad.
We've been able to give those day one skills so that they can effectively and confidently communicate the value of oral health.